In this video, we would like to present you ideal practice workflow on revenue maximization and cost efficiency. So, let's get started. Now let's analyze an ideal practice workflow and steps in engaging patient effectively for clinical and financial reasons. The first step is appointment call received. Workflow begins with patient's appointment. Certain key parameters are essential to obtain over the phone for better management and planning. Firstly, patient's name, phone number, date of birth, and gender should be taken over the phone. Right after that, other information like patient's insurance name, insurance ID for primary or secondary insurances can be taken. Lastly, important things to be taken are patient's primary physician, if any, and the reason for the visit. The second step is back-end eligibility verification team. Now, the work begins for back-end team. An accountable team works on verifying all eligibility of patient depending upon his reason for the visit. Fast track or basic eligibility can be verified using EHR or PM system. For certain visit types, practice may require to call insurance company representative to verify detailed benefits, authorization, and referrals. Depending upon eligibility verification, back-end eligibility team creates a financial plan and patient responsibility. Then they communicate to front office team for further actions. The third step is patient check-in process and checkout person at front desk. Now the front desk process of patient starts. Here receptionist will do the following procedures. First, she will verify the date and time of the last office visit. Then, she verifies all the demographics, including email and cell phone number. After that, she activates patient portal and provides brief tutorials through mail and addresses system alerts for financial issues. Now she collects patient balances due to co-insurance or deductible and completes appointment scheduling. Upon patient's checkout, finally she clarifies if any outside test or referral was obtained for convenience of patient. The fourth step is patient engagement by clinical assistants such as nurses or MA. Next step is patient's engagement with clinical assistants that are nurses. The nurse will validate the primary reason for visit and establish detailed history of the patient. She then generates medication reconciliation to confirm current medication taken by patient. Later she documents allergies, current vitals and reviews alerts for clinical reasons. She then distributes medical necessity questionnaire for diagnostic tests and procedures. Finally, she makes a list of procedures required to perform on patient before physician arrives. The fifth step is physician's workflow. From here physician takes over and begins his workflow. He receives all the details prior done by the clinical assistants. Now he just needs to review complete history, allergy, and reason of visit, and completed tests based on clinical protocol. Later electronic chart is completed by him through hybrid dictation or drag-in medical software or point-and-click EHR. This is how physician spends more time in patient's care rather than spending more time on rigorous procedures. The sixth step is back office or billing team. Physician sends completed chart and the information for billing to back-end team through various ways. This cycle of billing must be kept intact. The seventh step is operation team. This team would do monthly meeting and find out available options to reduce operational costs through automation or outsourcing services. And the last step is clinical reminder team. Lastly, clinical reminder team will do data mining from EHR or billing system to identify patients for horizontal growth. They send reminders to patients through SMS, email, automated call, or live representative calls and patient portal system. Above workflow plan would take practice to next level in revenue, cost, risk management and make them truly accountable in care.